Hello, my name is Manal Zaman, and today I'll be discussing the health belief model. The health belief model was developed in the 1950s by social scientists at the U.S. Public Health Service to understand why people would not adopt disease prevention strategies or take part in screening tests for early detection of disease. Soon afterwards, the health belief model was used for patients' responses to symptoms and compliance with medical treatments. The health belief model suggests that the likelihood of an individual adopting certain behaviors can be predicted by that person's belief in the threat of an illness or disease with a person's belief in the effectiveness of the recommended health behavior or action. The main components of the health-related behavior are the desire to avoid illness or to get better if an individual is already sick. Another component is the belief that a specific health action can prevent or cure the illness. And an individual's course of action often depends on the person's perceptions of the benefits and barriers related to that health behavior. The health belief model has 6 constructs, and the original constructs are perceived susceptibility, perceived severity, perceived benefits, perceived barriers, and constructs that were added later to the health belief model to improve the model are cues to action and self-efficacy. Perceived susceptibility refers to a person's perception of the risk of getting an illness or disease. And the perceived severity refers to a person's belief on the seriousness of contracting the illness or disease or leaving the illness or disease untreated if they are sick. With perceived severity, an individual often considers any medical consequences such as death or disability and also social consequences of how the illness will affect their family life and social relationships. The third construct is perceived benefits, which refers to a person's belief of the effectiveness of actions that are available to help reduce that threat of illness or disease, or to cure that illness or disease if they have it. The fourth construct is perceived barriers, which are obstacles that an individual may face when performing a recommended health action. Cues to action is the stimulus needed to trigger the decision-making process, which leads to accepting the recommended health action. These cues can vary from internal, such as chest pains or wheezing, or external, such as advice from others or learning of an illness in the family, or watching the news or reading an article. Lastly, self-efficacy refers to the level of a person's confidence in his or her ability to successfully perform a behavior. This is the infographic I created for the health belief model, and I broke it down in 2 parts so that way it's easily viewable. This infographic can be used for medical employees that deal with patients regularly and want to understand the thought process or the decision-making process that they have in regards to the COVID-19 vaccinations. So I have the constructs listed out here with perceived susceptibility. An individual might ask, what are the chances of me getting infected with COVID-19? Do I go to school? Do I work? Do I go to the grocery store often? The perceived severity, someone might ask, if I don't get vaccinated, I may suffer from mild or severe symptoms. So someone may think that because they'll probably deal with mild symptoms, they don't need to get vaccinated, versus someone that believes that their symptoms may be severe and they might be more likely to get vaccinated. The perceived benefits, someone may ask, if I get vaccinated, I won't be infected. And then another person might think if we all get vaccinated, life can go back to normal. With perceived barriers, an individual may, the thought process would be, if the vaccine is so new, I don't know if I trust it, or I can't find any information on vaccines in my area. So their barrier might be accessibility. Cues to action, hearing of my friend's uncle passed away due to COVID, so maybe I should consider vaccination. Or did you see how many people died from COVID in just one day? I'm seriously thinking about getting vaccinated. So those are some cues to action that may be external. Lastly, self-efficacy. The thought process might be, I am sure that I will get the vaccination as long as they are being given out to everyone. The most effective method of use to leverage the health belief model constructs for effective behavior change is to understand how each construct influences the others. For example, perceived susceptibility and perceived severity of a health condition together have been labeled as a perceived threat. Another example is the perceived benefits minus perceived barriers can support health behavior change, especially if the benefits outweigh the barrier of adopting that change. Other examples are self-efficacy and how it can influence perceived threat, which supports the initiation of health behavior change. For example, if an individual does not believe they are likely to face an illness, they are less likely to adopt that behavior change. Last example are the cues in the environment that can trigger action and act on perceived benefits and perceived susceptibility. For example, hearing the news of a family member suffering from severe COVID-19 symptoms can increase the perceived benefits of getting vaccinated. The health belief model has been used to develop effective interventions to change health-related behaviors for many years. Interventions based on the health belief model may aim to increase perceived susceptibility to and perceived seriousness of a health condition, but by providing information on the medical, financial, and even social consequences. The health belief model also helps understand the cost-benefit analysis of engaging in a health-promoting behavior with information on the perceived benefits versus the perceived barriers. Furthermore, interventions based on the health belief model may provide cues to action to remind and encourage individuals to engage in health-promoting behaviors. And lastly, interventions using the health belief model help boost self-efficacy by providing training in specific health-promoting behaviors, such as changing their diet or increasing physical activity. An HPV vaccination intervention is an example of the application of the health belief model. The overall aim of the study was to improve prevention of HPV by preventing HPV vaccination and increase condom use among students in Sweden. The study used perceived susceptibility, perceived severity, perceived benefit, and perceived barriers. And the socio-demographic factors such as age, sex, ethnicity, and parental education level were also used, because these are factors that can indirectly influence the individual's behaviors. After the intervention, students had significantly more favorable beliefs towards HPV prevention and were more inclined to use condoms during sex with a new partner. In addition, the intervention increased actual HPV vaccination rates. Another interesting factor about the study was that the increase in beliefs about HPV prevention from baseline to follow-up was higher among individuals with an immigrant background. It was also encouraging that these students reported higher scores for perceived susceptibility, that is, that they were aware of the risks. Immigrant background is known to be associated with increased risk of cervical cancer and lower attendance in cervical cancer screening programs. Lastly, significant differences were found between the intervention and control groups regarding perceived threat, where the intervention group's perceived threat towards HPV was higher. There was a limitation of the health belief model, which was that it did not consider emotional or relational aspects involved in decisions regarding the health behavior change. This factor I'll discuss later on in the presentation. Another example of the use of the health belief model is in a colorectal cancer intervention among Korean Americans. The study examined that the health belief model is based on the assumption that an individual adopts a health-related action such as regular colorectal screening, if he or she feels that adverse health conditions can be prevented. Also, if a positive expectation that by taking the recommended action, he or she can detect the early signs of cancer and prevent development of colorectal cancer. Lastly, if an individual believes he or she can successfully take the recommended action. The study used all 6 of the constructs to measure changes in behavior after the intervention. The findings indicated that the intervention resulted in significant positive changes in overall awareness, knowledge, and behaviors towards colorectal screening. The study revealed a number of new features which could have implications for the design of appropriate interventions, such as using culturally adapted approaches for program development, implementation, and evaluation. Societal factors such as these are not taken into consideration in the health belief model. Therefore, the social cognitive theory was also used in the study, not just to understand cultural factors, but also because the social cognitive theory explains that components of an individual's knowledge are acquired through observation of others through social interactions. The pros of using the health belief model are that it helps us understand perceived barriers and that different populations have different barriers. For example, receiving preventative care may not be as easily accessible to all populations. Therefore, studies are able to adapt to that when addressing each barrier. Another pro is that the health belief model helps to better understand perceived threat. And lastly, interventions can be aimed at the individual level by working one-on-one with individuals to increase engagement in health-related behaviors, or on a societal level, basically through maybe legislation or changes to the physical environment. The cons of the health belief model are that it doesn't take emotions or feelings in consideration when discussing behavior change. Evidence does suggest that fear may be a key factor in predicting health-related behavior. Another con is that individuals engage in some health-related behaviors for reasons that aren't related to health, such as exercising for aesthetic reasons, and it does not take into account behaviors that are performed for social acceptability. Another con is that the health belief model doesn't consider environmental factors outside an individual's control, since that may prevent them from engaging in desired behaviors. For example, if an individual lives in a dangerous neighborhood, they may be unable to go for jogs outside due to safety concerns, or even societal factors such as culture. Lastly, the health belief model lacks consideration of habitual behaviors such as smoking, which is not that easy to quit. There are a few theories that could help fill in the gaps in the health belief model. Such as discussed earlier, the social cognitive theory helps fill in the communication gaps since it is used for education and learning. And it also helps explain how individuals acquire knowledge based on observing others. So social acceptability can be a main reason why someone adopts a certain behavior, such as physical activity, to maintain a certain weight. Social cognitive theory also takes environmental and social factors into consideration, since some may not be able to adopt certain behaviors due to these reasons. Fear appeals theory is also another theory that can help fill in the gaps of the health belief model because it addresses participant emotions, which we discussed earlier. An example is COVID-19. According to Wong et al., in 2020, it was found that perceived threat did not increase the likelihood of getting vaccinated, and that the fear appeals may need to be used in future interventions to increase the likelihood of vaccinations. That is all I have for the health belief model, and I thank you for your time.